Hello and welcome to my channel. This is Ayush Chatterjee, currently a second year student of Medical College, Kolkata. Welcome to the second video of the series The Pathologies of the Liver. We are going to start with the first pathology, that is metabolic disorders of liver. Here we are going to study about three main disorders: hemochromatosis, Wilson's disease, and alpha-1 antitrypsin deficiency. Now before we go individually into each disorder, I will show you a video about the normal physiological interaction between hepatocytes and enterocytes. A normal hepatocyte will have certain surface proteins TFR2, HFE and HGV. They sense iron overload in the body, and these proteins in turn send signal to the HMP gene inducing hepcidin synthesis. In an enterocyte, the iron taken up enters into circulation through the ferroportin receptors. Now when hepcidin will come in and bind to ferroportin, it gets internalized. In the absence of ferroportin, the iron will no longer be released into circulation and stay inside the enterocytes. Hemochromatosis. Based on the etiology, hemochromatosis can be of two types. Primary involves mutations in all proteins regulating hepcidin synthesis. HFE gene mutations, most common adult form. HGV gene mutations, most common juvenile form. Other mutations in TFR2 and HMP gene. Altogether, these mutations will result in decreased structural or functional hepcidin. Secondary hemochromatosis or hemosiderosis, due to repeated blood transfusions, as in beta thalassemia or plastic anemia. There is a condition known as Bantu siderosis. Bantu is an African tribe who used to eat their food from iron vessels, resulting in increased iron levels in their body. It can also occur due to chronic alcoholic liver disease. Now, this excess iron which accumulates in different organs may have different manifestations. In liver, the excess iron results in hepatic failure, cirrhosis, and risk of hepatocellular carcinoma. In pancreas, the excess iron will cause damage to the beta cells of islets of Langerhans, decreased insulin release, and type 1 diabetes. When iron accumulates in the skin, it triggers an inflammatory reaction, increased melanin production, increased pigmentation. Together, the above two conditions is known as bronze diabetes. In the pituitary gland, the excess iron damages the growth hormone and gonadotrophin producing cells. As a result, there is retarded growth and failure to thrive. In females, oligomenorrhea, and in males, testicular atrophy. The hurt manifestations commonly seen are dilated cardiomyopathy and restricted cardiomyopathy. Finally, excess iron may deposit in joint space in the form of calcium pyrophosphate crystals, resulting in a condition called pseudo-gout. Hemochromatosis can be diagnosed as follows. Serum iron levels increased, transferrin saturation is also increased. The gold standard is biopsy. Stain used is pulse Prussian blue. Hemosiderin deposits in hepatocytes appear blue in color as shown in this image. Genetic test: autosomal recessive inheritance with HFE gene mutations. Treatment is with iron chelators. Now before we move on to the next pathology, I will show you a video regarding the normal copper metabolism in our body. Now copper from the intestine is absorbed through a specialized receptor ATP7A and reaches the liver, where it binds to apoceruloplasmin in presence of ATP7B to form ceruloplasmin. Now if free copper gets accumulated inside the liver, there are two pathways to release it: blood and bile. To release in bile, it again requires ATP7B. Now what happens in Wilson's disease? It is an autosomal recessive inherited disorder with loss of the protein ATP7B. As a result, free copper is not getting converted to ceruloplasmin in the liver. As a result of this, excess free copper accumulates inside the hepatocytes. This excess free copper will result in formation of reactive oxygen species. Copper may bind to sulfhydryl groups of proteins in the hepatocytes, and it may also displace other metal groups from enzymes. As a result of this, copper deposition in the liver in excess will result in hepatocyte damage, cirrhosis, and risk of hepatocellular carcinoma. Free copper may also get accumulated in the brain, and we found deposits in the basal ganglia resulting in tremors, lack of coordination, that is chorea. Finally, free copper may reach the eye, and there are deposits in the descemet membrane forming a brown colored ring known as Geiger-Fleischer ring. Diagnosis: serum ceruloplasmin decreased, urine copper levels are increased. The gold standard biopsy with rhodamine or orsin stain, we see brown colored copper deposits in hepatocytes, as shown in this image. Treatment is with D-penicillamine, zinc, and tritine. Moving on to the next disorder, alpha-1 antitrypsin deficiency. Again an autosomal recessive inherited disorder. Alpha-1 antitrypsin is a protease inhibiting enzyme synthesized by the PI gene. This gene has three alleles: PIMM, the normal allele, PIMZ, mild disease, codominant, and PIZZ, causing the severe alpha-1 antitrypsin deficiency. Now what really happens is, from the endoplasmic reticulum, there is defective transfer of alpha-1 antitrypsin to Golgi bodies. Now as a result, alpha-1 antitrypsin accumulates in endoplasmic reticulum. This results in a ER stress, and finally this stress will cause apoptosis of hepatocytes. In biopsy, we see accumulation of misfolded proteins in the form of periodic acid Ceph positive diastase resistant globules, as shown in this image. There may be risk of hepatocellular carcinoma. Moving on to autoimmune cholangitis. Based on the type of ducts affected, can be of two types: primary biliary cholangitis, and the second type is primary sclerosing cholangitis. Primary biliary cholangitis is characterized by inflammation of small and medium-sized bile ducts. Like any other autoimmune disorder, the pathology remains same: a genetic predisposition with drugs, toxin, or any other environmental insult. Together, these etiologies will result in a T-cell mediated damage to the bile ducts. This damage will cause production of a neoantigen. This antigen in turn triggers formation of antimicrobial antibody against T2 component of PDH complex. As a result of this immune mediated damage, there is proliferation of ducts. This will result in further increased production of autoantibodies and lymphocytic infiltrates, which will result in more proliferation of ducts. This cycle goes on until and unless there is a stage of burnt out ducts, which finally result in the characteristic biliary cirrhosis. The microscopic features of PBC are periportal inflammation, proliferation of ducts known as hyperplasia ductuli, long-standing cases resulting in ductopenia, feathery degeneration of hepatocytes, finally gallland fibrosis, as shown in this image. Symptoms are jaundice and itching. Elevated liver enzyme may be seen, and it shows AMA positivity. Primary sclerosing cholangitis, there is inflammation and fibrosis of intrahepatic or extrahepatic large ducts. Small and medium ducts are affected due to cholestasis. Again, we see a genetic predisposition in the form of HLA-B8, drugs, toxin, or more importantly in this case, ulcerative colitis. In ulcerative colitis, we have formation of P-ANCAs. These P-ANCAs will cross-react with antigens present on the surface of the bile ducts. As a result, there will be destruction of the walls of the large ducts. This may finally result in dilatation of the large ducts, increasing the risk of lithiasis or stone formation. Fibrosis may occur surrounding the ducts, giving rise to onion skin appearance. Now, on long-standing cases, fibrosis will completely replace the ducts, resulting in a condition called tombstone fibrosis, as shown in this image. The fibrosis is patchy and giving rise to beaded appearance in ERCP. This is how an ERCP looks. So thank you all for watching this video. I hope this video has been of help. If you enjoyed this video, please like and share this video with your friends. If you are new to my channel, then please don't forget to press the subscribe button. That's all for today. I will be back soon. Till then, stay safe and have fun.